You're listening to Addiction Medicine Beyond the Abstract, the official podcast of the Journal of Addiction Medicine. If this is your first time listening, thanks for coming. Addiction Medicine Beyond the Abstract is produced for your enjoyment and is focused on the latest journal-published research and science in the field of addiction medicine. Remember to add us to your favorites in iTunes, and you can also follow us on Twitter at ASAM.org and Facebook. Now, let's go beyond the abstract. Welcome back to another episode of Beyond the Abstract. Thank you so much for joining us once again. We've got another great interview for you today. We're sitting down to talk with Dr. Matthew Sloan. Dr. Sloan stopped by to discuss his new article in the Journal of Addiction Medicine titled Symptom-Triggered Alcohol Withdrawal Management Delivered Over Telemedicine. His study investigated the feasibility of delivering symptom-triggered alcohol withdrawal management over telemedicine, and in the intervention, participants received 3 days of symptom-triggered withdrawal management using a modified version of the CWA. Results showed that 93% of participants completed all 3 days of alcohol withdrawal management. No participants required transfer to a higher level of care. Satisfaction with treatment was high, and 56% of participants remained abstinent from alcohol after 1 month of follow-up. All right, let's learn a little bit about our guest today. Dr. Matthew Sloan is a clinician scientist at the Center for Addiction and Mental Health in Toronto, Ontario, Canada. He specializes in the treatment of substance use disorders and their psychiatric comorbidities. He completed medical school and psychiatry residency at McGill University, followed by a postdoctoral fellowship in human psychopharmacology at the National Institute of Health and an addiction psychiatry fellowship at Yale University. Dr. Sloan's primary research interests are developing innovative new treatments for substance use disorders and exploring detriments of psychopharmacological response to drugs of misuse. He's obtained competitive research funding from the Canadian Institutes of Health Research, Health Canada, and the Center for Addiction and Mental Health Discovery Fund, and has received scientific prizes from the American Academy of Addiction Psychiatry and the National Institute on Alcohol Abuse and Alcoholism. All right, now let's get into today's talk with Dr. Matthew Sloan. Thank you for taking the time to come on and talk with us. Very excited to talk to you today. And we're going to start with why addiction medicine. So let me ask you, Dr. Sloan, what was it that led you to the field of addiction medicine? Of all the fields you could have studied or pursued, what was it about this particular field of practice that interested you and got you involved in it?
Yeah, well, I did a couple of addiction electives as a medical student, and I just found the field fascinating. So from a scientific perspective, the idea that a substance could sort of hijack somebody's brain and become the most important thing to the extent that they'd be willing to potentially lose their job or lose relationships just to use the substance. Like what exactly was going on in the brain that made that happen was interesting. And I think from a humanistic or medical perspective, it can be a really satisfying job as a clinician to care for patients with addiction. So, you can really see somebody's life transform when they stop using an addictive substance. Completely in a way that you don't necessarily see for other conditions. You see people who stop being addicted to a substance, they're able to get back to work, they're able to resolve their relationships, they're able to feel better physically and overcome psychological issues. So you can really see a complete transformation, and it can happen fairly quickly when somebody overcomes an addiction.
Yeah. We're going to dive a little bit into a bit about your article here. And so I want to lead off with this. Tell us a little bit about some of the advantages of delivering symptom-triggered withdrawal treatment via telemedicine relative to clinical treatment in other settings.
Yeah, well, I think one of the major advantages is just being able to do the treatment from anywhere. So especially for people that live far from treatment centers or specialized hospitals, I think this has the potential advantage of really expanding access to care, which is a major problem. I mean, a lot of people have difficulty accessing care and withdrawal management. I also think there's a big comfort advantage. It's a lot more comfortable to do withdrawal management in your own environment than to go into a sterile hospital room where you don't necessarily feel comfortable. I think those are two of the main advantages. I mean, I think there's another advantage, which is the feeling of self-efficacy that people can get by doing withdrawal management at home. So when you finish withdrawal management, obviously the goal is not to use any more alcohol. It's to stay abstinent. And it's easy to do that in a locked environment or in a hospital environment where you don't actually have access to alcohol, but you need to be able to do that in your home environment where there are stressors, there are triggers, there's the ability to get alcohol. And so I think for patients that did this at home, they were able to see that they were able to go through the process and not drink. And I think that made them feel confident that they'd be able to not drink in the future.
Right. Well, and you touched on it a bit. You were talking about, some of the folks that may not be able to make it in or don't want to come into a hospital, but tell me more about some of the populations that may really benefit from this telemedicine-based alcohol use disorder treatment.
So we know that less than 10% of people with a past year alcohol use disorder actually receive any treatment for alcohol use disorder. And one of the major reasons for that is people don't know where to access care, or they don't have access to good specialized treatment facilities. And I think a large part of the reason for that is that many addiction specialists work in large urban centers, and there's a lot fewer addiction specialists who are working in rural communities and remote communities. And so what telemedicine allows you to do is it allows you to have these specialists who are working in urban centers deliver care out to rural and remote communities that don't traditionally have access to that type of care.
That makes a lot of sense. And you also, earlier you mentioned how some of those challenges that come about are, you're in your own environment, there are triggers, and it's easier to get, a hold of alcohol. So talk to me a little bit about some of the potential concerns or challenges that maybe practitioners should be aware of with implementing telemedicine-based substance use disorder treatment.
Well, I think you have to carefully select which patients are appropriate. I think that's one major thing. So for our study, for example, our patients needed to be able to check in repeatedly throughout the day during each day of alcohol withdrawal management care. And not everybody's necessarily able to do that. And we also needed people where doing withdrawal management at home would be safe. So for example, we excluded patients with a history of withdrawal seizures or with a history of withdrawal delirium, just because we didn't think it would be safe to offer them withdrawal management over telemedicine. Like, those people should really be treated in a supervised facility. We also excluded patients with unstable psychiatric disorders. And what I mean by that is somebody who would be actively psychotic or manic. I don't think would be appropriate for this type of treatment. So I think the idea of carefully selecting patients is really important when you think about this type of telemedicine-based care. I will say, though, I work at a tertiary care psychiatric hospital. So most of our patients had concurrent psychiatric disorders. So they weren't necessarily, they were still complex patients with other issues, and they were still able to benefit. But I don't think every patient is appropriate. One other thing is we only took patients that had a stable place to live to do this type of treatment. So there's certainly patients that I think might be less appropriate for telemedicine-based care, and especially telemedicine-based withdrawal management.
Sure. And looking down the road, I wonder if you can talk a little bit about how maybe health services like therapy treatment can be delivered utilizing the same telemedicine platform after withdrawal management is complete. Does that look like something that you think is possible down the road, and what would that look like?
So one of the things I think that was really successful about our program is that we integrated medication for alcohol use disorder and therapy directly into the treatment. So when a patient completed their 3-day withdrawal management course, we tried to meet with them the next day to discuss adding medications for alcohol use disorder and getting them started with therapy. And it was the same team that was delivering the medications and the therapy. So I think that was really helpful, and we had a really high uptake of both medication and therapy after withdrawal management. So over 90% of our participants went on to take medication for alcohol use disorder or do therapy. And I think that's a gap in treatment at a lot of facilities. I think a lot of facilities sort of just offer withdrawal management and then say, you should schedule a follow-up appointment with your normal physician. I think the problem with that approach is it can take weeks to get a follow-up appointment. And we know that relapse can often happen really early. So we're talking about in the days, week after somebody completes withdrawal management. So it can be too late by that point to actually prevent a relapse. So I think meeting with patients as soon as possible after withdrawal management, making sure they get onto this track and having it integrated with the withdrawal management can really be helpful.
And looking ahead as well, I wonder what kind of future research questions kind of came about from this feasibility trial. And looking at that, what do you think in terms of future sort of like research studies that might be able to address those questions and resolve some of them?
Yeah, so we implemented this study in Toronto where I work, so it's a large urban center. And so there's a sort of this implementation question of how this would work if you were delivering the care to rural centers or populations that live farther away. We actually have a follow-up study going on where we're working with First Nations communities in Ontario to adapt this intervention for those communities and see how well it works in those communities. So I think these type of implementation studies will be important to sort of see how it works in practice when delivering the intervention to remote run rural communities. I think the other thing is we need to understand how this compares to more traditional interventions. So, for example, is telemedicine withdrawal management equally effective to doing the withdrawal management on the inpatient unit? We don't know that yet. So I think these are some big questions that we still have.
That's really interesting. And shifting gears a bit as we kind of come to the close of our episode, we always like to ask for a little bit of advice and wisdom. So I want to know, what kind of advice or wisdom would you share to the upcoming generation of addiction medicine professionals, and maybe even to your younger self when you were just getting involved in the field or getting interested in the field? What would you like to share, and what do you think is important to know?
Well, I think maybe I'll flip that question and say, for me, I think about what are the challenges for the next generation of addiction medicine practitioners. And I think there are some big things, some big problems that we need to address as a field. So there's this big problem of access, which I already mentioned, which is very few patients are actually getting evidence-based treatments for addiction. We are able to treat some patients with evidence-based treatments, but there are lots of patients, like I said, in rural communities globally who are not getting any high quality addiction care. And I think the next generation of addiction medicine professionals needs to really think about this question hard and figure out ways to expand access to treatment. I think another thing is that we're struggling with the amount of treatments we can offer. Like, there are addictions where we really have very few good treatments. I think cannabis use disorder is a good example of this, cocaine use disorder. And we need to be thinking about what are some novel ways that we can address those conditions. What are new medications that could potentially be helpful? What are new modalities that could potentially be helpful? Like brain stimulation is an area that's being studied a lot. Is that something that could potentially be useful for addiction? So I think I would encourage the next generation of addiction medicine professionals to think about these big problems and sort of try to push the boundaries of what we can do.
I love it. Dr. Matthew Sloan, thank you so much for stopping by and talking with me today.
Thanks so much for having me.
This ends today's podcast. Thank you for listening to Addiction Medicine Beyond the Abstract. All of today's show links can be found in the show notes. Remember, you can preview additional abstracts at journalofaddictionmedicine.com. This program was produced by the American Society of Addiction Medicine.